it's afternoon where I'm living at, so I wanted to say good afternoon to you guys. I am back again with some more Nclex tips for you guys. So my name is Valentina and you are on Valentina's Corner, so I am welcoming you to my channel. Today this is my corner. I find this area to be the quietest place in my house to be able to video for you guys and make content that will really help you guys without too much noise. So if you like what I put out, please be sure to comment, like, share, and subscribe this information. I am a registered nurse. I've been a nurse for over 10 years now, and I find that the information that I put out there is information that is useful for a lot of people, and I wish I had this type of information for myself when I was first starting out as a nurse. I tell you guys, there were a lot of videos out there, but more of the videos that they had put back then 10 years ago, or say 11, 12 years ago, were more about how much money do you make as a nurse, Nclex RN tips and tricks, but more on like content, exact material. For me, that was really boring, so I couldn't really relate to that kind of material. But this material, excuse the noise in the background. I don't know, you guys might still hear the noise in the background, but hey, this is how it is, you guys. Mom nurse life, right? Just focus on my lips, whatever I'm talking about, if you hear noise. But yeah, so basically I decided to make raw material, raw content about realities about being a registered nurse, at least in the United States, and just decided to put out content that will help anybody who was in my situation to help excel, so that you don't feel so burned out right away, not even on your first job, right? We don't want that. So this is it. So for today, what I want to focus on for you guys is the real truth about the Nclex RN. The real truth. All of what the secrets of that nobody tells you about the test. All of the nitty-gritty. As in, the main thing about the Nclex RN that you didn't know, that I didn't know, that a lot of people don't know, still don't understand, but it is the clearest truth, the most common sense thing out there about the Nclex RN is guys, it is what I just said, common sense. The truth about Nclex, the first true thing about Nclex that I didn't know is that it is how you're supposed to practice nursing. The Nclex RN test is strategically designed for you to have a straight bridge from being a student to being a registered nurse. That's why this test is so important. Not only because it is what will give you the RN license, but it is because it is designed to make your mind cross from I am a student nurse to I am a nurse. Why do I say this? Nclex RN is mostly prioritization. Okay? Hold on a minute. I gotta tell these kids to be quiet. Yeah, raw and uncut. Raw and uncut. There is no fakeness here. But that's how you have to deal with life, right? You gotta keep going, keep pushing no matter what. And then we're making so much. Do you guys not hear that? All over the place. Oh my goodness. Anyway, yeah. So the thing about nursing the Nclex RN is that the questions, the way they are structured, they are so that you can bridge from being that student nurse to that registered nurse on the floor, wherever you choose to work as a nurse. So the most important thing for you to know is that when you're preparing for the Nclex RN, you're preparing to become a nurse. When you enter that room, you are a nurse. Do you understand? Do not look at it as, yes, it will determine whether you will practice or not, but it won't determine whether you are a nurse or not, because you graduated nursing school. So that means you are an educated nurse. You only need that license. So to get that license so that you can practice safely, you have to pass the Nclex RN, because the Nclex RN is for nurses. Do you understand? So when you sit down and take that exam, look at it as, you can't tell me I'm not a nurse. I am a nurse, because I graduated from my school with this degree. Therefore, I can pass this exam. So henceforth, as you take this NCLEX, as you prepare for this NCLEX, put this in your head. You are a nurse already. This test is so that you can just go out there and practice. But because you are a nurse already, you need to know how to do what? Prioritize. NCLEX is here again. The secret that is the most common secret is it is all about prioritization. It is all about critical thinking. It is all about just using your best judgment. If it is not about your judgment, what is it going to be about? You need to be able to know how to judge situations when they're presented to you. Because believe it or not, when you're on that med-surg floor, there are going to be things that you've never seen in the books that you're going to need to figure out how you're going to prioritize this person's situation over someone else's situation, or priorities whatever the different conditions the person has come in. How are you going to present them to your providers so that they can write the best treatments for the patient? So it's all about that. It's all about prioritization. It's all about critical thinking. It's all about judgment. I'm so pissed every time I'm trying to do something. That is when something doesn't work. Why do they decide to make so much noise right now? This is the time I'm making this video. This is the time. This is the time they decided to bang on walls. This is the time they decided to throw toys. This is the time they decide to cry. So yes, that is what I did not know before graduating nursing school. I took the NCLEX RN Kaplan review course, and I reviewed using their textbook, and I took the questions from the Saunders book. And of course, I graduated nursing school, but nobody came to tell me that, oh, the NCLEX RN is for nurses. You see what I'm saying? Of course, used for nursing students when you graduate, but nobody conditions your mind to get that confidence. Nobody really tells you the truth about the test and why the test is the way that it is, why it is designed to be that way. If you know why it's designed to be a certain way, if you know who it is designed for, it will help design how you're going to study for it. Do you understand? And I want you all to get the confidence that when you graduate nursing school, when you have that degree, when you walk on that stage, you are a nurse. You are just needing to get that license to be able to practice. Once you feel like a nurse, you know you're a nurse, you already have the confidence. So you're going to sit in front of that computer and say, you're not going to tell me whether I should practice or not, because I am already a nurse. I'm about to show you. Do you understand? And that is how you're going to be able to say, okay, these are the questions. How do I prioritize the answers? Because I tell you what, I want to say 60% of the questions of the NCLEX, I had no idea what the answer was. I'm telling you straight up, I had no idea what the answer was. I tell you, I was about the brink of failing 2 or 3 classes in nursing school because they were just so hard, and I had not figured out yet until like I want to say my 3rd semester into nursing school, the right way of studying for nursing school. Like I was just spending hours and hours and hours on end reading the book from the beginning to the end, and then by the time I get to the exam, all the questions they're asking me are questions that they just focused on in the classroom and nothing about the chapters they said we should read. So then I was always in that bubble, like, you know. So yeah, 60% of the questions on the NCLEX RN exam, I had no clue what the answer was. Yes, I had heard about the condition. Yes, I had reviewed them, but what I had reviewed was not what was on the exam. So there you go. Nursing school prepared me for that. So that means that it is not about all the things that you know. It is about how do you prioritize your condition when it is presented to you. Because when you go to the hospital, when you go to the nursing home, when you work home health, when you do case management, when you do care management, that is how it's going to be. You're going to have patients who have maybe I'm exaggerating, but thousands and thousands of different conditions that you may or may have not heard of. How do you prioritize the condition so that your patient can be safe? Safety. That is all what it is about. Safety is another thing about the NCLEX. It is really about safety. So when you go into it and you know that, oh, they just want me to be a safe nurse. They just want me to be a nurse who uses judgment, best judgment at that. They just want me to be a nurse who uses critical thinking. You will just immediately know how to answer all your questions, because you now know that they're not trying to trick you to figure out if you know what amlodipine is or not. Well, you should know what amlodipine is, but they're trying to figure out how do you handle a situation when it's presented to you. That is why if you go to a nursing school, usually most good nursing schools, they focus a lot on how do you call it, like case studies or case reviews, because they present to you a condition and they want to see how do you use your mind to assess the condition, add pi and assess the condition, diagnose as a registered nurse, of course not medically diagnosed. How do you plan, right? How do you implement, and how do you evaluate? Correct? So that is what they really want you to do for each question in the NCLEX. So that's really what I was not told. I was not prepped by nobody, because nobody has time to do that. And if you don't ask the question, if you don't know what questions to ask, then you don't really get it. You don't really get that kind of answer. But I'm here to let you know that the NCLEX RN is not here to trick you. The NCLEX RN is not here to determine whether you are a nurse or not. It is here to say you are safe to practice. You are safe to be a nurse out there to give care. So let me tell you this. If you had a nurse who did not pass the NCLEX RN and is out here struggling and has taken the test 10, 15, 20 times, would you want that nurse to practice on you? Think about it. Because the NCLEX RN is designed specifically for nurses, right? For nurses who can use critical thinking, safety, and judgment to practice. So if you're a nurse out there who has not passed the NCLEX RN, let me be straight with you. Pass that test the next time you take it. Because otherwise you're going to need to sit down and do some serious thinking about what is it that you're doing wrong in terms of critical thinking as a nurse, judgment, using your best judgment to answer the questions. And another thing is safety. Because if you don't figure out how to do those three things, and there may be more things, but this is what I remember right now, you're going to be confused on the floor, because you're just going to be having all these things that you learned in your mind and you don't know how to prioritize them. You don't know how to plan your day, because you're going to have, I told you, I have a video where I talk about how I worked on an acute care, almost memory care, but not really memory. It was like acute care, subacute care, facility where I had 45 to 50 patients. I was the only nurse, the only RN. They had LPNs, but guess what they do in facilities like that? They put LPNs for another set of 35 patients or 40 patients. So that LPN is not to help you. She's there to be by herself. But if some stuff go wrong on her side and the state walks in and the DON is not around, even if the administrator is around, the RN is going to be questioned, because your degree really says that you're managing LPNs and CNAs. So watch out. That's another video for the type of jobs that you get. But just to let you know, going back to what I was saying is, I had 45 patients, only about 2 to 3 CNAs on a day shift, right? If I did not know how to critical think, if I did not know how to prioritize, if I did not know how to use my basic best judgment, right? If I didn't know how to do that, it would have been a mess. Initially, it's very hard, even though you know how to do these things. But it is the basic for you to say, okay, let me take a deep breath. I have 45 patients. I know this is a lot. But what can I do to make it better? Right? And I have a video prior to this one where I discussed what is it that you can do in your first nursing job so that you don't burn out, so that you feel like you have a better handle on things, so that you feel like you have a plan. The main thing is you need to have a plan. But how do you plan? By having critical thinking, by having best judgment, and by having critical thinking, best judgment, and safety in your mind. Correct? So that's basically what I wanted to come here to discuss with you guys today. It is really the bread and butter, or whatever they call it, the steak and the meat and potatoes, whatever you know those sayings. It is that about NCLEX. Know this, and it to shape everything on how you're going to study for the NCLEX, or how you're going to prepare for the NCLEX. Because I'm really big on, you don't need to be studying for that. You need to prepare for that. You understand? Prepare. Take questions, as many questions as until your hand is tired. That's when you know you're ready. When your hand is tired, when you've seen so many questions and you get a headache from even looking at the computer, you know you're ready. That's how you know you're ready. All right? Okay, thank you so much for watching Valentina's Quarter. I thank you so much for supporting me so much on this channel. Once again, don't forget to do what? Comment, like, share, and subscribe. Let me know what is it that you need more help with when it comes to the NCLEX, when it comes to nursing, when it comes to anything healthcare. Let me know, and I will make videos specific for that. I'll be linking down below again the books that I use to prepare for the NCLEX RN. The Kaplan review course, that's something that you need to go on the Kaplan website to check what they will offer around your area, and also consult with your teachers to find out if they offer those in your school. But as far as the book that I use for the review, and also the practice questions from the Saunders book, I will link them down below again so that you can click on them, go and purchase them, and begin practicing. All right, thank you so much. Take care and have a wonderful day. Bye.